Healthy schools, healthy kids. Today I'll be discussing environmental injustice in U.S. schools, how inequities in environmental health funding and policy affect millions of children, and what can be done to ensure every student learns in a safe environment. In my journey as a school social worker, I've become more aware of how environmental conditions can deeply affect students, their well being, and academic potential. Recognizing my own position of privilege reminds me that advocacy must begin with listening to and amplifying the voices of those most impacted. In the United States, over 13,000 school districts serve approximately 75 million children. While environmental hazards are commonly present in homes and neighborhoods, children often spend a substantial amount of time in schools. Despite the significant number of children affected, there has been a notable lack of attention to environmental threats in schools, with no federal agency explicitly tasked to safeguard these environmental health of educational institutions. The funding model for schools, which is primarily reliant on local property taxes, creates disparities not only in the quality of teaching and learning resources, but also in the maintenance of school environment and the selection of locations for new school sites. I've realized that environmental conditions are often invisible in social work conversations about equity, yet they are foundational to health and opportunity. Understanding this helps me broaden my perspective on what advocacy for children truly means. Entire communities face the detrimental impacts of exposure to hazardous substances, but increasing scientific evidence supports the notion that children are more susceptible to environmental pollution than adults due to fundamental physiological, metabolic, and absorption and exposure differences. According to Neal, children's faster breathing patterns compared to adults allow for greater intake of air pollutants per pound of body weight. Furthermore, their skin and body tissues may absorb harmful substances more readily, and their developing bodies are more susceptible to the adverse effects of toxic exposure on growth and development. As a social worker, it challenges me to think holistically about environment, not only home or school culture, but the physical air children breathe every day. Marginalized communities are 79% more likely than whites to reside in neighborhoods where industrial pollution poses considerable health threats. This highlights the urgent need to address school funding systems that sustain inequality. Schools with a marginalized population of 50% or more, and those where 70% of students qualify for free or reduced lunch, often lack the necessary resources and need for more funding to improve their condition and result in an unsafe learning environment. These patterns reflect systemic oppression, the result of historical zoning, housing, and education policies. As a school social worker, it's important that I approach advocacy with humility and awareness of how these systems continue to shape opportunity along the racial and economic lines. Half of all students suffer from poor indoor air quality, which has been shown to adversely affect students' performance in mental tasks requiring concentration, calculations, and memory, thereby impacting their academic achievement. Studies have linked polluted indoor air to increased rates of allergies, asthma, and various respiratory diseases. Notably, asthma, as the primary chronic illness affecting children, presents a substantial challenge, causing an estimated 14 million missed school days per year. A study of DC public schools concluded that students attending schools in poor conditions scored 11% lower on standardized tests compared to those in well maintained buildings. Behind every statistic are real children and families. When I think about students missing school due to asthma or developmental issues tied to toxins, I see a direct call for social workers to advocate in both the micro level, supporting families, and the macro level, pushing for healthier school policies. In 1994, the Education Infrastructure Act was the first to allocate grants to improve school facilities through repair, renovation, alteration, or construction. However, these funds were discontinued in 1995 as part of an effort to balance the federal budget, which severely hindered progress in school infrastructure. In 1997, President Clinton sent an executive order establishing the EPA's Office of Children's Health. Despite its creation, the office faced scrutiny and was criticized for failing to effectively leverage its resources to protect high-risk groups. In 2001, the No Child Left Behind Act introduced high-performance schools. This marked the first occasion that child environment health issues were brought to the Department of Ed, paving the way for future conversations. In 2007, the federal government enacted the Healthy High Performance School Act. Its mission is to enhance the design, construction, operation, and maintenance of K-12 schools. It prioritizes safety, health, environmental sustainability, and student learning by enabling and encouraging states to establish and implement school environmental health programs. This timeline shows how advocacy and policy are interconnected. It reminds me that as social workers, we must not only respond to policy, but help shape it. Ensuring children's environmental health is seen as a human right. The EPA's Healthy Schools program focuses on reducing environmental health risk in K 12 schools. They provide essential guidance, resources, and technical assistance that schools and districts can voluntarily adopt. All schools and states can utilize these resources to perform self assessments, identify potential hazards, and implement low or at no cost improvements. It demonstrates that healthier school environments can improve both academic outcomes and operational efficiency. All resources provided by the program are available at no cost, with a particular focus on the Title I and rural districts that have limited infrastructure support. Grants are available through the EPA's schools programs. Programs like these are helpful, but because they're voluntary, inequities persist. This reinforces for me that advocacy must be justice informed, addressing the root causes like structural racism and funding disparities, and not just the symptoms. Currently, Minnesota law requires schools to prioritize student health and safety through several measures, and they must establish comprehensive and safety programs. In 2003, the Elk River School District, serving 10,000 students across 17 schools, initiated a high healthy performance school program to address these inadequate facilities. This collaborative approach created financial support from the Department of Education, Department of Health, and their local school district and state agencies to construct a new high school and elementary school and build an addition to a junior high school and renovate 6 schools. Seeing examples from Minnesota gives me hope. It also shows how collaboration among educators, policymakers, and social workers can make a real change. In my own practice, I want to partner with schools and families to identify risks and push for safer environments. It is essential to coordinate federal funding to ensure equitable and healthy learning environments for all children and youth, especially those from marginalized communities, as this is fundamental to their health and well-being. Improving school facilities will not only benefit students, but also working parents who may experience fewer absences from work and lower medical expenses when their children are not exposed to environmental hazards. Additionally, school staff will enjoy better working conditions, and the federal budget will benefit from decreased healthcare costs. Environmental justice isn't a separate issue from education or social work. It is social work. Our code of ethics calls us to challenge injustice wherever it happens, including in the buildings where children learn. My approach to advocacy is centered on justice-informed practice, meaning I view environmental health as a human rights issue rooted in systemic inequity. Advocacy for me means centering the voices of marginalized families, pushing for equitable resource allocation, and using data and stories to influence policy at every level. Every child deserves to learn in an environment that nurtures, not harms their health. Addressing environmental injustice in schools isn't just about buildings, it's about equity, dignity, and opportunity, as our children are the leaders of tomorrow and their well being is crucial for a sustainable future. This work starts with awareness, recognizing your own role, privilege, and responsibility. As justice informed professionals, we can move from awareness to action by ensuring that no child's zip code determines that their right to breathe clean air at school.